I would just call it chemophobia that is very
Yeah.
strong in social media spaces, which is this fear of chemicals, any kind of chemical. There's a fear of sugar because there's this like kind of anti-sugar movement. And so it's
Yeah.
like, why would we be giving people 50 grams of sugar? That's not like normal, or 100 grams of sugar. And that's not normal under like normal constraints. And so one of the things I try to educate on is why a challenge test is important, right? Because it's true. Like, and if you kind of think about it, it's like, okay, well, I don't really eat like that. So why do I have to go and do that? I'm just going to eat. Like if I'm not doing that, then my system won't be stressed. But the whole idea is to really stress the system to make sure we identify any underlying issues that maybe we couldn't identify if we were just monitoring you with how you normally eat. And then we would miss gestational diabetes. And then, a month down the road, it would present itself in a worse way.
As someone who's had GDM, gestational diabetes, and it was hard. I'm not going to deny that. I want to really stress the importance of these tests because from a pediatrician standpoint, I see what uncontrolled gestational diabetes can do to an infant and a newborn, obviously. And so these things are not just made up, as Jessica has said. Like there's reasoning behind why we choose these tests and why it's recommended over a pancake or jelly beans or things like that.
So here's the thing about the OGTT, the oral glucose tolerance test. It's the only validated way to diagnose gestational diabetes. Why does that matter? Why is validation so important? Well, validation is important because it ensures that we have criteria, right? So we need to have these criteria in order to make a diagnosis. And so if you use an alternative that has not been well validated, has not been well studied, has not looked at, okay, well, what are the cutoffs? And then how many people are actually experiencing symptoms and outcomes because of this because of this condition in those cutoffs, that's what validation is looking at, right? And so that's what the OGTT has been wonderful for, and it's why it's the gold standard all around the world for gestational diabetes diagnosing.
Welcome back to the show. If you are watching this, you are on our YouTube channel. Thank you so much for being here. We love being able to provide these podcast episodes to you on our channel here. So make sure to subscribe to stay up to date on all of our future guests coming on the show. Today's guest is a social media favorite of mine. She is Dr. Jessica Knurick, PhD in nutrition science and registered dietitian with an emphasis on pregnancy and postpartum nutrition. And we are talking about pregnancy and postpartum nutrition myths. What's safe? What's hype? How social media is getting involved in a good or not so good way. So thank you so much for joining me today, Dr. Jessica.
Yeah, absolutely. I'm so excited to be here.
Yeah, and I'm excited to follow you on social. I found you, I would say within the last year. And like I said, whenever I find accounts that, I love, I'm like, how did I not know about this person? How am I just following this person? So for anyone who's not familiar with who you are, what you try to do online on your Instagram handle, tell us more about yourself and why you do what you do.
Yeah, sure. So, as you mentioned, I have a PhD in nutrition science, and I'm a registered dietitian. And when I started on social media, I started maybe 2.5 years ago. I started making content specifically for the pregnancy and postpartum space. Primarily because that was what I had studied quite a bit, but also because that's the stage of life I was in. And so I was finding just a lot of kind of not so great information out there. And I thought that maybe I could bring some more evidence-based information to the space because it's a space that is really heavily targeted by misinformation online, which we'll kind of get into, I'm sure. But so I started making content on there, and it's primarily I do pregnancy-focused nutrition content and then also postpartum and breastfeeding content. It's gotten a little bit into kind of like early childhood nutrition as well. But that's mostly what I do. And it started off me just kind of educating in different areas that I thought were important, particularly around like foods to avoid or foods to include and how to better your nutrition. But as I was doing that, I just really realized how much misinformation is out there. And people would just send me videos and ask me things like, is this true? I'm sure you get those a lot as well. And I've kind of evolved the content a bit into more correcting just the immense amount of misinformation that's out there, like directly correcting it, which I think can be helpful to people because they're used to seeing it and then they can identify and spot kind of what to look for when they see kind of those corrections.
Yeah, we've connected over that because we do a lot of stitches or response videos, of other people's content. And it is an interesting evolution of being on social because I also never started doing that, right? I obviously knew that there was misinformation around, my niche of pediatrics for vaccines proteins or, all this other stuff with skincare products or food and all that. But it definitely has evolved into, no, let's correct this. And, there's a thought that, well, are we even be able to educate that way? And I do believe that, right? You take something that's misinformation and say, hey, here's why it's not correct. Here's what you can do with this information. I think it does do a lot of justice in a space that does elevate a lot of misinformation. Like, we know that.
Yeah.
Like,
I
I
mean,
mean,
I've
the
actually heard from people that it's more helpful sometimes
yeah.
because again, they see the misinformation and so they're used to hearing these different things, and then if you can directly kind of counter that with evidence-based information, it can be helpful for people, I think.
Yeah, and also because it's coming from all different directions. Like right now, at the time of this recording, people have DM me, can you talk about fluoride? Like, can you talk about this? And every given day, like you, it's like I already
Yeah.
have my content set up that I would want to do without debunking. And then I get a whole other, 20, 30 content ideas from debunking all of this stuff. And I think you agree. It's not even just about debunking, it's about adding the middle ground nuance, right? Not everything is black or white. I mean, some of the things about fluoride, for example, for me is like, okay, it's understanding why this is a benefit, how much is too much, all of that. And I think that's where we kind of lie in terms of making sure people understand that it's not just like don't do this or do this. It's here's why and here's what I need you to understand and why we give this recommendation, which the gray is not sexy on social media. We know that. Like people don't
Yeah.
always want to
Yeah.
hear the gray, but when we combat misinformation and stitch, it does become, I think, more, it reaches the algorithm a little better too, which I agree.
Yeah, that's very true, and I do think that there's something to be said for, just I think I've become a more effective educator,
Yeah.
honestly, like, with doing it this way because it helps me to understand where people are where they're how do I say it? Like, where they're held up, what
Yes.
their concerns are, right? Where I might not know that because I just kind of know the evidence-based information, and if I'm not working with people one-on-one or if I'm not hearing where their concerns are, I don't know specifically to educate in that particular area. And so it's actually helped me.
I agree. I love. There's obviously a love hate. Not, I would say more of a love relationship with social media, because it does allow a lot of connection with more people, and my words can get out to more people. But yes, there is definitely a benefit, I would say, in terms of becoming a better pediatrician for myself too. And I resonate completely in that I get smarter and more educated on, well, what are they saying? Let me actually do a deeper dive into what the more recent guidelines. So I always joke that I should get CME credit for all the stuff that we do online. I'm like, why am I having
Yeah,
to go to conferences when I spend literally my entire day debunking and researching and looking at the balance
totally.
here? So, like I said, I know a lot of the stuff you talk about is obviously amazing education, but you are debunking a lot of the things. And what we're going to talk about today are, things like misconceptions about food safety during pregnancy and an area that you always talk about, which is the Glucola test in pregnancy. And then also,
Yeah.
if we have time, maybe prenatal vitamins. But I'd love to tackle first about the common foods pregnant women are told to avoid, that might be misunderstood or outdated advice. And again, what would you think is the biggest misconceptions you see about food safety or what you're hearing online in regards to food safety during pregnancy?
Yeah, so I think when you come into pregnancy, there's a really big emphasis on like what foods should I eliminate out of my diet, and so for a very long time that was the focus, and it still very much is, but I do think that it's kind of shifting a bit. But a lot of times providers would just kind of like hand a list of foods to avoid, and I think pregnant women wouldn't know that like why they
Yeah.
needed to avoid those foods. And so I'll give you a good example. One time I got a message from a girl who she was terrified because she forgot she was pregnant, which I know sounds ridiculous, but it can happen. Like
Yeah.
you're like you're out with your friends or whatever, and she ate a sandwich, and I don't know that she forgot she was pregnant. I think she forgot that that was a rule,
Yeah.
quote unquote, to not eat deli meat during pregnancy. And so she sent me this message, not understanding why that rule existed or why that she had ever heard to not eat deli meat, and she was so scared because she thought that she had done some sort of damage to her baby and by eating this sandwich. And I think it's a really good kind of example of how when we don't kind of explain why these recommendations exist, and what the actual risk is of these recommendations, it can cause a lot more harm than good, in a lot of cases, and kind of stress a lot of people out. And so in the sense of foods to avoid, there's a lot of kind of misconceptions here. So I think the major misconception is, why do we have these
Yeah.
foods to avoid? And it's really a food safety reason, right? And so the idea here was we were trying to identify what are the highest risk foods and telling people not to eat those when they were pregnant because they were more high risk than other foods. The problem is that that's not necessarily evidence based. When you actually look at the data of where foodborne illness comes from, and particularly like listeria, where listeria comes from, which a lot of it comes from fruits and vegetables, which
Right.
have never appeared on those lists, right? It's always been very disproportionately animal based products, and so something like cheese, soft cheese, we kind of blatantly say avoid soft cheese. That's what a lot of people hear. Whereas, I mean, the vast majority, particularly for us in the United States, the vast majority of our soft cheese is pasteurized,
Yeah.
right? Which significantly reduces risk of listeria and other foodborne illnesses. And so consuming, pasteurized soft cheese, which again, almost all of it is not really a high risk food. Um, Another one is deli meat is a big one, which I just mentioned. Now, deli meat does skew higher risk, right? It is more of a high
Yeah.
risk food, and so that's important to educate on. But if you heat deli meat, particularly to 160 degrees, that eliminates that risk of listeria, right? And so that can kill those pathogens for foodborne illness. And so, kind of educating on that. And honestly, even it's like a case by case basis, because let's say you have to weigh like pros and cons, because every single food contains risk, and that's what people
Yeah.
don't really understand. And so sometimes I'll educate on this and I'll be like, oh, the risk is this, and so sometimes the pros outweigh the cons, and I'll have people in my comment section like, oh, well, I wouldn't even risk it for a 2% chance. And I think the misunderstanding is that literally all food contains some sort of risk, some kind
Right.
of risk. And so that's important to remember, because for example, well, let me stick on the deli meat example. So, if you heat it eliminates risk. But for some women in pregnancy, and I've worked with these women, there's so many symptoms. You've been pregnant. We have
Yeah.
to deal with so much during pregnancy, and protein can often be a huge food aversion for people. And
Yeah. It
so,
was for me, for my
you,
second. Yeah.
yeah, and some of those people, they can stomach deli meat, right? And they
Mm-hmm.
can stomach a sandwich. And so, if that's the only place that they're able to get their protein, is the risk, the very small risk, to be honest, the absolute risk is quite small, of listeria, does it outweigh the risk of not getting protein in pregnancy, right? And so you kind of have to weigh those things. And I think another one is like runny eggs. Runny eggs, it's obviously safer to cook your eggs, but some people cannot stomach cooked eggs. And the only
Mm-hmm.
way that they can get eggs is by having them a bit more runny. And eggs are an incredibly wonderful food during pregnancy. I mean, they're really the sole source of choline. I
Yeah.
mean, you can get choline from other meat products, but I mean, the biggest source is going to be from eggs. And so, if they can do it, I mean, eggs account for about 2% of all food poisoning cases in the United States. And so, it's not a huge disproportionate risk, if that's the only way somebody can eat it. Now, if you want to like even lower your risk even more, avoid runny eggs, right?
Right.
If you want to get it as low as possible. But for some people, the pros might outweigh the cons, and I think that's what gets lost in the conversation with kind of like foodborne illness risk in pregnancy.
And so of course we know like listeria for deli meat and also for cheeses, and then of course the biggest one that I always hear is like sushi for the
Mhm.
mercury risk. And what are your thoughts about the sushi? Same concept?
Yeah, I mean, not just yeah. So let's just talk about fish in general, right? Because
Yes.
this is another big one. So everything I've talked about so far, those recommendations come from kind of a foodborne illness risk,
Yeah.
right? Fish actually comes from a mercury risk, and so this is a wonderful example of kind of misconceptions about pregnancy nutrition. So um, a lot for a long time, it was recommended to just kind of avoid fish, because of the risk of mercury. We have a ton of research has come out in the last couple of decades showing just the immense importance of things that fish contains, particularly omega-3 fatty acids like DHA for neurodevelopment.
Yeah.
And so that is fish can be a really, really helpful thing, particularly for DHA. And there's been some studies that have recently come out that have looked at fish intake in women during pregnancy and neurodevelopmental outcomes on offspring, both like in the immediate period, like infancy, and then also a couple of years out. And they've shown, I mean, there's been good research to show strong links between DHA intake, particularly fish intake, and neurodevelopmental outcomes. But a couple of studies that have recently come out actually measured mercury content as well, and they showed higher mercury in the women who ate more fish, which would be expected, but also with the higher level of developmental outcomes.
Mm.
And so, you could look at that and be like, oh, is mercury causing better developmental outcomes? Well, obviously no, right? But it goes to show you that this is kind of like where the benefits of fish intake outweigh the potential risks of consuming mercury. And there's also, what gets lost is there's a number of nutrients in fish that kind of help negate the negative effects of mercury. So, for example, fish is high in selenium, and selenium binds to mercury and doesn't allow it to kind of like absorb into the body. So, those types of things. And so, when we talk about fish, we still want you to avoid high mercury fish. I
Mhm.
mean, I would suggest we all kind of avoid high mercury fish, right?
Yeah,
Things like
even without
shark.
pregnancy. Right,
Yeah,
exactly.
even
Yeah.
even outside of pregnancy.
Yeah.
But the emphasis really should stop being, avoid high mercury fish, and we should really start educating on like consume low mercury fish,
Mhm.
low and moderate mercury fish. And if you ever want to know like which fish are low and which fish are high, the EPA puts out a really great document of like low, moderate, and high mercury fish and which options to choose from.
I love that. Yeah, I kind of attribute this to, you were talking about that message that you got when someone was concerned about eating the deli meat and the panic that can ensue when you hear this
Yeah,
messaging that don't. And I use the example of like honey in infants under one. For pediatrics, like obviously I've said this before, but we don't recommend honey for infants under one because of the risk of botulism. But it doesn't mean that you accidentally gave the honey and they're going to have botulism, right? Like it doesn't
correct.
mean that you eat the deli meat and that you're going to have listeria or some foodborne illness besides listeria. And what you said was so perfect about that it tends to be, the media or the lists tend to focus on plant-based products because I know there's been outbreaks of listeria in cantaloupe or other fruit that
Oh,
we've
yeah.
mentioned, and those things can happen, but you can't not eat anything. Like you can't just live a life of like in fear that everything that you put in your mouth is going to lead to a foodborne illness. So in your opinion, like you've been pregnant as well as me, how would you tell a peer to approach this, right? Knowing that there are these lists, knowing that we obviously want to reduce risk as much as possible. What would be your advice to someone who's listening who may be pregnant at this time that has that sort of, well, I don't want to do it and I don't want this risk. Like, how can they kind of evaluate what's safe or what's not?
Yeah, so it's a great question, and this is definitely a thing that I hear all the time. People are like, "Well, I just can't eat anything because
Yeah.
everything." I see everything. Ice cream had listeria, and then broccoli had listeria, and just all these different things, right? I think it was just in like frozen waffles. There was a recall
Yes.
in frozen
Yeah.
waffles, and so, what I would say is that first, I think it's really helpful to understand the risk. So, in terms of listeria, which is what we always tend to talk about, because it is the most dangerous of the foodborne illnesses, particularly in pregnancy, and so that's why there's so much focus on it. But there's the CDC estimates that there's about 1,600 total cases of listeria every single year in the United States. Now, how many people are in the U.S.? Like 330 million
Million.
people.
Exactly. Right.
Yeah. So it's a very, very small absolute risk,
Yeah.
right? And so when we're talking about high risk foods, I'm putting that in quotes if you're not watching. We're talking about the relative risk, right? Relative to other things, but the absolute risk of these foods is quite low in terms of listeria risk. Um, and so I think it's really helpful to understand that because sometimes because maybe we're talking about it all the time, it seems like it's a higher risk than it actually is. You know what I mean?
Well, yeah.
And then after that, I would just say when we're thinking about our food during pregnancy, just look at it as kind of like a food safety lens on all of our food, right? So all of our food we should probably not leave sitting out because
Yes.
that is kind of like a harboring ground for bacteria. And so kind of eating food right after it's prepared. Don't eat from like hot food bars and like those types of restaurants where their food is just sitting out all the time. Restaurants have a disproportionately high risk of foodborne illness. So, not eating at restaurants as much can be helpful. Do you have to do that? No. Did I do that? No. I still
Yeah.
ate at restaurants. But if you are a little bit more risk averse, cooking your food at home is definitely going to increase or decrease risk. And then, like refrigerating your meat products, thawing things in the refrigerator instead of on the counter, those types of things. Avoiding pre-cut fruits and vegetables, pre-cut things can harbor more bacteria than if you cut it yourself. So just cooking things to the temperatures, like I said, 160 degrees for meat can kill listeria. So all of those things are going to mitigate the already kind of low risk that you're facing with foodborne illness in pregnancy.
I love that advice. And, talking about everyone has different levels of being risk averse is totally true. It applies to so many things that I talk about as well. Like in my pregnancy, like you said perfectly already, that I had protein aversions in both my pregnancies, but even worse with my daughter. And I had gestational diabetes with my daughter. And so
Mhm.
protein was really important in my diet because I really couldn't
Yeah.
eat a lot of other things. And so I did eat deli sandwiches because I crave them. And I think I craved them because my body wanted the meat and like the nutrients of that meat product. And I didn't eat it every day, but I went to places. I made it myself, or I went to places that I know had good quality products that I trusted. Our local grocery store was always had good hygiene and all of that, and how they stored everything. But I did make them myself sometimes. And I never really eat deli meat sandwiches without being pregnant, but it was
Yeah.
something that I wanted.
Isn't
And
that
I think
funny?
about that Friends episode. If anyone watches Friends, like when Phoebe doesn't eat meat, and all of a sudden she's craving like the deli sandwiches. Like it just happens sometimes, and like you really want it. And I mean, I think having this conversation and understanding with yourself and your partner, if they're involved, of like, I really want this, and I understand there's a risk, and how am I going to reduce my risk, and am I comfortable with this? And the other thing I would say is that when you make these decisions, being okay. God forbid something were to happen and you did get listeria, which is so rare. Like, I mean, I make these decisions of all these risk aversion things, and I'm like, okay, if I do this, am I going to get it, and am I going to remove the guilt if something were to happen? Yeah, like, because I know that these chances are low, and we do the best that we can. And like you said, you balance what you need to balance so that you can get the nutrients you need, satisfy the cravings, which I really struggled a lot with gestational diabetes and not being able to eat a lot of my cravings. And that came in the form of getting to eat my deli sandwiches. So I love that you brought up that example, because I'm an example of doing what you said.
Yeah, yeah, and it's just such an important point that, like, everybody has different circumstances, right? And so what like, for example, I don't eat deli meat. I
Yeah.
haven't eaten in, like, 15 years, so it was really easy for me to be like, "Well, I'm not gonna eat that because that's kind of a riskier food," but for somebody else like yourself, and I love that you brought up the gestational diabetes example because that's so true. Like protein is so important if you have gestational diabetes, and so it's just such a perfect example of like when the pros might outweigh the cons.
Yeah, like the eggs, like the runny eggs, like any egg would make me gag, which never did. And we would always eat this chicken dish from this restaurant, and the sight of the chicken dish would make me gag. Like it was so
Yeah.
prominent, the aversion to protein, like you said, and I needed protein. I mean, so I really like that. So thank you so much. And I think that's such a great way to kind of introduce this conversation about the misconceptions and the myths out there, and how people may relay this information, not only on social, but even from a medical perspective, right? Like we'll give those lists, and it's like very black and white without the nuance which you just described. So thank you. And another thing that I did want to talk about was the Glucola test, or the glucose test in pregnancy. So for anyone who's not familiar, which maybe people who may not have had the test yet, why is this test important, and what is it testing for? Which we kind of just alluded to with my gestational diabetes, conversation.
Yeah, I'll just kind of quickly
Yeah.
describe what the test is, and I'm being specific to the United States because there's a couple of different ways to test, and there's different ways around the world. But in the United States, we do a two-step process. So we do a screening test, and this all happens generally between 24 and 28 weeks of pregnancy. So the bulk of testing happens during that time. And so the first test is a 50 grams of glucose. So it's a drink. It's kind of it's a very small drink,
Yeah.
and it's just flavored with 50 grams of glucose, and so it's quite sugary. And the idea is to kind of strain your body's glucose regulation system. So what we're looking at is how well your body responds to that 50 grams of glucose. So how much is your insulin producing insulin to respond to that huge glucose load that's now in your blood, and is it getting rid of the glucose in an effective manner? So that's what we're looking at. So for the screening test, it's generally a non-fasting test. The idea is it's not, because these are pregnant individuals, we're trying not to kind of stress them any more than we need to. And so kind of come in, it's 50 grams of glucose, so it's a smaller glucose load, and it's only an hour long. And so the idea of it is it's a screening test to kind of screen people out who are low risk, and whose bodies are effectively managing that glucose load, and then have a cutoff for people who tend to be higher risk, who it looks like they may be at a bit of a higher risk of our diagnostic criteria, or of being diagnosed with gestational gestational diabetes or of actually having gestational diabetes.
Yeah.
And if that's the case, if they're above that cutoff, they'll go on to a 3-hour test. And that 3-hour test is a diagnostic test. So sometimes there's a little bit of confusion of why there's two tests and what's the difference between a screening and a diagnostic. So that's really the difference. Is the screening test is really just meant to be kind of low burden on everybody,
Yeah.
because the vast majority of people don't have to go on to the 3-hour test. And so they just kind of need to do the 1-hour test, and then they go on to the 3-hour test, which is a diagnostic test. That's 100 grams of glucose. And so they go in to a 3-hour test and they sit there, and then we measure their blood at certain time periods, and look for those diagnostic cutoff criteria. And the whole idea here is that, again, we're measuring and we're looking at how well your body kind of metabolizes and utilizes glucose. Because what happens and why testing is done between 24 and 28 weeks is because that insulin resistance increases in all normal, healthy pregnancies.
Mm-hmm.
It's just a function of being pregnant. And it generally happens, it does happen because of the hormones in your placenta, plus increased body fat that happens, again, in all normal, healthy pregnancies and is really important. And so that insulin resistance increases. And so for some people, though, because of a number of reasons, their body is not able to handle that increase in insulin resistance. And we're able to see that between the 24 to 28 week mark generally. And so that's why we wait until that long to test. And so that's what we're looking for. We're looking for, are you able to utilize that glucose? Because if you're not, that glucose is going to stay in your blood. And if it
Yeah.
stays in your blood, it's going to pass through the placenta and it's going to go to your baby. And what happens then is, as it goes through the placenta into your baby's pancreas is going to have to overproduce insulin, which can cause a number of issues for the baby, including macrosomia, which is a large for gestational age baby, a large baby.
Yeah, and for anyone who's not familiar, like I said, I had gestational diabetes with my second. I didn't have it with my first. I got the screening test for my first. I got this screening test for my second. Needed to get the diagnostic test because I didn't pass the screening test, like Dr. Jessica was chatting about. If you want more information about GDM in general, about how it impacts the baby, I have a YouTube video that will link to show notes as well as on the YouTube caption, because it is a very useful video on why this is so important from the fetus side, from the baby side, and also for mom, because we want to keep mom healthy. Now, my question for you is, Jessica, you spent so much time on your social combating a lot of misconceptions around this test. So I'm curious what those misconceptions are, or people talking about, let's use alternatives like just eat jelly beans, or that the Glucola test is harmful. So I would love for you to explain what you've been hearing and sort of explain why that might not be true and what people should know as they go into these tests and the importance of them.
Yeah, that's a great question. I mean, this is also, just before I answer that, I just want to say this is a good example of how being on social media has kind of made me a better educator, because I did my dissertation work in the area of diabetes. And so I
Mm,
was really in it. Like, I've run hundreds of OGTTs in the lab, or glucose tolerance tests in the lab. And I just didn't realize that there was so much pushback because I was
interesting.
kind of
Yeah.
just kind of secluded from it. And so being on social media, I've realized that there are these concerns from women. And so a lot of them have to do with the glucose test in general. So there are some people don't tolerate it well, and that is true. You're drinking a large glucose load, and myself included, by the
Yeah.
way. I was fine drinking it. It kind of tasted like, I didn't mind the taste. It was kind of like a flat orange soda.
Yeah.
Um,
Yeah, I felt the same. Very sugary. Fanta
Yeah, it
is
was
how I
like
described it.
was
Yeah.
reminiscent of my childhood. I was like,
Yeah.
"Okay,
Yeah.
this is pretty good."
Yeah.
But afterwards, I was super lightheaded, and,
Mhm.
you don't really wanna feel those types of symptoms, particularly when you're pregnant and already
Yeah.
not feeling great, right? Luckily, this is done in the second trimester when people are generally feeling better, but, yeah, so I had those symptoms too, and so I know a lot of women experience even worse symptoms than that. They actually can't even tolerate the drink. Now, I said a lot, but it's a small minority of women, but you hear about it. And so I think that there's a concern, first of all, and a rightful concern about, symptoms of the test. And so just acknowledging that and explaining that those symptoms those things can happen as a result of taking the test, and just kind of trying to explain that the pros of identifying gestational diabetes outweigh kind of those issues that might happen, like feeling nauseous. And so that's one. Another big one is just I I would just call it chemophobia. That is very
Yeah.
strong in social media spaces, which is this fear of chemicals, any kind of chemical. Um, People are a bit, there's a fear of sugar because there's this like kind of anti-sugar movement, and so it's like,
Yeah.
why would we be giving people 50 grams of sugar? That's not like norm, or 100 grams of sugar, and that's not normal under like normal constraints. And so one of the things I try to educate on is why a challenge test is important, right? Because it's true. Like, and if you kind of think about it, it's like, okay, well, I don't really eat like that. So why do I have to go and do that? I'm just going to eat. Like, if I'm not doing that, then my system won't be stressed. But the whole idea is to really stress the system to make sure we identify any underlying issues that maybe we couldn't identify if we were just monitoring you with how you normally eat. And then we would miss gestational diabetes. And then, a month down the road, it would present itself in a worse way for a person. So trying to educate on kind of the underlying physiology there. Some of the ingredients are of a concern to some people. So there the government just stopped utilizing BVO, or they kind
Mhm.
of, I don't know what's the word. It's not outlawed. I'm like blanking on the word.
Like,
Um,
restricted, or I guess,
yeah,
yeah, like, doesn't allow it in products
they
anymore?
took it out of
Yes.
the
Took it
food
out.
supply,
Yes,
right?
exactly. Yeah.
It's no longer allowed to be used based on some research, not that showed harm in humans, but it just as a precautionary thing. And so BVO did used to be used in some Glucola drinks. Now it hasn't been used at least in the last year since I've been looking at Glucola drinks. Far
Yeah.
before they even stopped using, or they came out and said that they weren't going to use it anymore. It hasn't been used, but people still perpetuate that because if you come out and say a toxic, quote unquote, toxic ingredients is in glucola and all the doctors are giving us glucola, that makes for good social media content and it
Yes.
spreads fast. So that's one of the things I try to combat, and just letting people know that is not even an ingredient in the glucola test. And it's also, literally a one-time drink. So even if it was an ingredient in the glucose test, I mean, glucola is not something we're having you drink every single day. It's a
Exactly.
medical test. It's one-time drink for a medical test, just like oral contrast for a
Yes.
colonoscopy.
Exactly.
Like nobody wants to drink oral contrast every day.
Exactly, and I
Um,
and I love that because that is exactly it, is that I think when you hear that, you're like, "Well, they're poisoning us." It's like, "Well, no, you're literally taking this once in your pregnancy," and like you said, even if even though I agree that I'm not concerned about the safety risk of it, and even so, they took it out. So it's like, now here, thank you. And I think when they took it out, what happens a lot of the times when regulatory bodies take out things or regulate things, and it's like I told you so. And I love that you say it. It's like, it's listening to what's happening, and it's also just doing precautionary things like taking out red dye. Like that's a similar movement in pediatrics right now, that yes, red dye, there is some research showing that it may impact ADHD children a little bit differently, but taking it out of California's foods in schools is just a precautionary thing. It doesn't mean that not everyone can have red dye and that you're going to be a horrible mom or dad if you give your kid red dye occasionally, right? It's all
yeah,
about occasionally. um,
exactly.
and what are, people, are you hearing that there's alternatives that are equally useful as the Glucola drinks, or for you the Glucola drink is the best from what you've researched and your expertise?
Yeah, let me go over some of the alternatives.
Yeah.
First, let me correct myself because I said oral contrast for a colonoscopy, and it's really oral contrast for a CT scan,
Yeah, yes, yes,
and a
I understood.
laxative solution for a
Yeah.
colonoscopy. So if like there's any medical professionals, like that's not what you use.
Yeah.
Okay, so anyway, the alternatives, that's also a big one that I educate a lot on. So here's the thing about the OGTT, the oral glucose tolerance test. It's the only validated way to diagnose gestational diabetes. Why does that matter? Why is validation so important? Well,
Mm.
validation is important because it ensures that we have criteria, right? So we need to have these criteria in order to make a diagnosis. And so if you use an alternative that has not been well validated, has not been well studied, has not looked at, okay, well, what are the cutoffs? And then how
Yeah.
many people are actually experiencing symptoms and outcomes because of this condition in those cutoffs, that's what validation is looking at, right? And so that's what the OGTT has been wonderful for, and it's why it's the gold standard all around the world for gestational diabetes diagnosing. Now, some of the um, alternatives that I've heard a like breakfast situation, where somebody has like a pancake breakfast and juice, and so I kind of try to educate on how that is completely different
Yeah.
than drinking just glucose, because you have not only all of the different types of sugars in there, which are metabolized differently, but you also have protein, fat,
Yes.
fiber, all of which are going to very much affect glucose excursion or the glucose release into the blood from your meal. And so we don't have diagnostic criteria for a meal. And so it's to me, it's like, why even do the test? Because it's not telling you if you have gestational diabetes or not. So that's one. The jelly bean test is a big one that I
Yeah.
see. And that's based on a single study in 1999 that looked at jelly beans. I think it was 48 jelly beans, but don't quote me on that. So it looked at a number of jelly beans and compared it to glucola. And basically there were 5 total cases of gestational diabetes in that study. 4 out of 5 were correctly diagnosed with glucola, and 2 out of 5 were correctly diagnosed with jelly beans. So what that tells me, obviously, is that the glucose test was twice as sensitive at detecting gestational diabetes than jelly beans, and it means that jelly beans are not an effective way to test for gestational diabetes. And that's the only study that's ever been done looking at jelly beans, and so it's just not a valid alternative. Jelly beans are also very variable, right?
Yes,
So
like the
like,
type of the flavor, right? Like
yeah, the
black liquor.
flavor,
I'm
the
already like black
size.
licorice. Yeah, black licorice jelly beans, which is my favorite. I know it's weird. Is not going to give
Yeah.
you the same as like a sugary lemon lime or something like that.
Yeah, and
Yeah.
also chewing and eating something
Yes.
is a very different way of
Yes.
consuming that sugar than drinking it. And so it's just, again, it's not a valid way. I think it's because glucose reminds us versus something like oral contrast or the
Yeah.
laxative solution. It just reminds us more of food. And so people are like, well, maybe I can have alternative food
Mm.
sources like orange juice instead of that. Where we wouldn't do that for those other medical tests, right? Where you're also consuming something. So orange juice is another big one. The problem with orange juice is it's over half fructose as a sugar. Fructose is metabolized very differently than glucose.
Yeah.
And so the glycemic index is much lower than for fructose than glucose. And just to tell you, fructose is 20 to 25 depending on the source, which is how quickly it spikes blood sugar, whereas glucose is 100. So
Yeah.
there's a huge difference, a huge variability there. And so again, it's not a valid test. And then the last one I would say is at-home monitoring. And this one, again, it's not a valid way to diagnose gestational diabetes, but it's the best alternative that we have for people who are contraindicated for the gestational diabetes test. And there are people like that. Like, for example, if you have gastric bypass surgery,
Hmm.
right? Those people are going to generally be people who are going to do at home monitoring. People who literally can't tolerate the glucose test, which there are people who, they just keep throwing it up because maybe they're experiencing hyperemesis gravidarum during
Yeah.
pregnancy and they literally can't keep things down. So at home monitoring is kind of the best approach for them. I think traditionally a lot of physicians have had them do 2 weeks of at home monitoring. I would, from someone from the research space, I just think that that's not enough. I think that it would be far better to have them do 2 weeks and then have them monitor throughout the rest of their pregnancy a bit,
Yeah.
right? Because again, you're not putting them under strong conditions in those 2 weeks of monitoring, 2 to 3 weeks of monitoring, and so it's very possible that insulin resistance will continue to increase, and you'll miss cases of gestational diabetes. And so, kind of monitoring like very frequently throughout the rest of pregnancy can be helpful.
Well, thank you so much for our listeners to understand the difference between glucose and fructose because they are
Yeah,
different. And the fact that, I
there's
mean,
a
I
lot
know,
of information. Sorry.
but it's so important because like you said it perfectly, like the people think because it's a food source like glucose and like, let me just eat pancakes. Those have sugar in it. Let me put some syrup
Yeah,
on it.
yeah.
That there are other nutrients in that, which is why it's not the same, right? It's glucose and those glucose tests, which like I said already, I agree. It tastes like very sugar, flat orange soda. And
Yes.
I didn't mind it either. I actually enjoyed the taste of it because I was like, I love Fanta or whatever orange soda brand you like. But I also did have for both my pregnancies the same symptoms that you described. Like after those tests, I felt very lightheaded and jittery, like just trembling from the sugar. And for my son, I didn't have gestational diabetes, and for my daughter, I did. And so, as someone who's had GDM, gestational diabetes, and it was hard. I'm not going to deny that. I want to really stress the importance of these tests because from a pediatrician standpoint, I see what uncontrolled gestational diabetes can do to an infant and a newborn, obviously. And so these things are not just made up, as Jessica has said. Like there's reasoning behind why we choose these tests and why it's recommended over a pancake or jelly beans or things like that. And so to listen to the experts and ask the questions, whether it is obviously to your clinician or on social media, but I would prefer that it would be to someone who knows your history and all that, because that is so important. I mean, this is not, no one, we're not trying to harm anyone. Like, I think one of the biggest frustrations both you and I share is that we both are mothers. We both have been pregnant. And, I'm a pediatrician giving pediatrics advice. Everything that I would say to my listeners and my followers and my patients are stuff that I would want for my own self. Right. And so when people don't agree or don't understand that, I'm so confused. I'm like, no, there's no agenda behind this. Just, I want people to stay healthy and not have sick kids or be hospitalized for issues that we can possibly control. Like, it's just
Yeah.
boggles my mind.
Yeah, completely agree. Or they'll call you like a shill, like a
Yeah.
big
I'm
pharma
like, how am
shill.
I a shill? Like, I'm literally like, and it's just gonna always be the case, but you're doing the good
Yeah.
work. What would be your
Well, I
final?
just think
Yeah.
I
Yeah.
think it's hilarious when someone calls me a big pharma shill. I have a PhD in nutrition science. Like, I don't have
Well,
anything to do with this
I mean,
pharmaceutical
already with
industry.
pharmacy, like, I mean, and I always, all the pediatricians just joke because we are the lowest paid specialty. And I've said this before,
Yeah.
like, we are the lowest paid medical specialty in all the specialties. So if we were truly getting paid by big pharma, we wouldn't be the lowest paid specialty, would we? Like, let's use some
Right.
common sense. Like, and
Yeah,
it's
if
not
you were getting
happening.
paid kickbacks for every
Like,
vaccine.
no, it's not like the surgeons get paid more because they're doing procedures because insurance companies like procedures. They don't like
Right.
pediatricians and give money to us. So it's not anything more than just trying to keep people out of our offices. But of course, social media doesn't always follow that. Jessica, this was wonderful. What would be your
Can I
final?
just
Yeah, go ahead.
Can I just say one thing just related to you had mentioned that you were really jittery after you took the glucose
Yeah.
test. I just wanted to just mention a really good strategy for people when they're going into their glucose test is to bring a high protein snack to eat immediately after. And that can be really helpful to kind of assuage or lower that risk of feeling super like jittery and like lightheaded. It won't prevent it 100%, but it can help a lot just
Can that
getting
be
something high
done?
protein.
Can that be done before the blood draw?
So not with
Yes.
no,
No,
not
it
with the
can. Yes.
diagnostic test.
Yes, correct. So that's why I couldn't. Right. So meaning, it
Yeah.
has to be done after the blood draw is done.
Directly after the blood draw.
Awesome.
Yeah.
Great
Good
clarification.
good point of clarification,
Yes, no,
not
because I was like,
after you
wait, they
drink
told me
your
I
drink.
couldn't because I was
Yeah,
gonna
no.
take something. They're like, they told me no, but that makes sense. Yeah. For
Yeah.
right after you get the blood draw done so that you don't feel those symptoms. Awesome. Well, now
Yeah.
you have inspired me to have a whole episode about GDM in general because of your experience. But thank you so much for joining me
Yeah,
today.
absolutely.
What
Yeah,
what
yeah.
would be your final uplifting message for everyone listening? Obviously we talk about some heavy things about like the glucola and the foods to eat, but what would be your message to people tuning in today?
I think that just in pregnancy can be, really a difficult time because
Hmm.
you're going through a lot of obviously like symptoms and it's this whole new world that you really don't know anything about. And I think that we're at this period. It's just this time period when we also have so much to learn, right? And so we're just consuming information all the time, and just being really like careful and about where you're consuming that information. Be really cognizant about protecting your mental space during
Yeah.
this time because as somebody who I'm just finishing like I'm still breastfeeding my almost 2-year-old. I'm almost done though, and that chapter's closing in my life. So the pregnancy breastfeeding chapter will be done for me. And so I feel like I'm at like this unique period to realize like it was a difficult time, but it also kind of like I don't want to say magical and be all cheesy, but it's also a really, really special time in life,
Yeah.
you know? And so to really just protect yourself during that time. And if your algorithm is feeding you fear mongering, terrifying information, just keep blocking those pages because
Yeah.
you don't need that. You don't need that kind of negativity in your life, you know, and just identifying the places and people that you trust and that don't bring you a ton of anxiety. If you are watching and consuming content that is constantly bringing you anxiety, that is not the place to be.
Love it.
So that's what I would say.
I love that message. I that's why I started my platform too, and I love that you're doing the same thing. Where can people go to stay connected? Where is your Instagram handle? To obviously learn more about all of the things that you're sharing on your social.
Yeah, so I'm pretty active on TikTok and Instagram, and it's the same handle. So Dr. and then my name, Jessica Knurick, Knurick.
Awesome. I will be attaching that to the caption here, as well as show notes. Thanks again for joining me today, Jessica.
Yeah, thank you so much. It's been so great.
And for everyone watching, please make sure if you love this episode, give it a thumbs up sign. Make sure to subscribe to my YouTube channel so that you can stay up to date on all the amazing conversations that we're going to have. Thanks again, Jessica, and thank you for everyone for tuning in today.
Thanks a lot.